Hi everyone. Today we will be demonstrating the emergency department module in Tamanu. We think it's a great module. We're a little bit biased, of course, but one of the great things about the emergency department module is it's one of the best demonstrations of how digitizing your systems allows you to completely change and improve your patient flows, your clinical workflows, and the physical management of your space. In a busy emergency department or a busy outpatient, where you are relying on paper to manage triage, to manage waiting lists, where you're relying on whiteboards, it limits your ability to physically move patients in an optimal way, and it forces staff to have to go to a physical object like a piece of paper or a whiteboard to review a patient's record. Once you digitize and once you automate your wait lists, it really allows you to then optimize your space. So for example, a patient that's been assigned to a fast track area can be physically moved to a completely different space of the emergency department. The clinicians there can look at their records, they can see the exact same waiting list that someone in another section of the emergency department is looking at, but they're all interacting with the same information. It also allows a clinician who might be at the nurse's station in the emergency department or somewhere else in the hospital to look at a patient's record and to look at the encounter and to review some information while someone else is looking at that information. You don't have to have a chart that physically moves around between clinicians. So someone can be collecting vitals while another person is looking at a lab result, for example, and that's perfectly fine. So once you've got that freedom, it allows you to, as I say, optimize those workflows and make your whole space more efficient. And automating the wait times really helps to clean up the sort of messy, waiting areas that you'll obviously see in a lot of busy primary healthcare settings. So let's crack into it, and I'll show you a couple of workflows. And we'll go from there. So we're going to deal with a patient called, go with this one, Cool Test, who has arrived at the emergency department. We're going to go through a basic patient journey and just use that to show you a couple of the tools in Tamanu. So we're going to triage the patient. Now, the triage date and time automatically sets. You can set your own arrival date and time if it's different from the triage time. We'll leave that for now, but if you know what their arrival time was, you can set that. And we'll also say that they're in the waiting area. And one thing that you can do with Tamanu is use it for your location management, your bed management. So you can see here that someone is already in acute area 1. You can see that it's occupied. So we wouldn't put a patient there. And I don't have to go and physically check the space. I don't have to turn around and look at whiteboards or wander down to somewhere else in the department. I can see what is occupied and what isn't. With other areas, like the waiting area, we can put unlimited numbers of patients in there. It won't ever say that it's occupied, so you can set that or configure that however suits your department. The arrival mode we capture for data collection purposes, so we can say they arrived, whatever, on crutches. And here you can see the triage score. Now, the emergency department module in Tamanu is built around the interagency integrated triage tool, which is a triage system that is being implemented in a lot of emergency care settings across the Pacific. We're very grateful to a number of people who've been involved in this, particularly including Rob Mitchell and his team down at the Alfred, but a whole ton of people that have contributed to this. That's a system that applies workflows around a 3-tiered triage system. But Tamanu is also configurable. So what we're looking at today is a 3-tier triage system plus deceased, which you can capture in the triage workflow. But you can have 4 triage levels, you can have 5 triage levels, you could have 10 if you want it to be really inefficient, or you could have 2 on in a basic outpatient department, for example. So it's all completely configurable here. You can set your own colors, you can name them whatever you like. So we're going to go with emergency, priority, and non-urgent. And we're going to make Cool Test non-urgent and say that their chief complaint is, let's go with back pain. You can also record a secondary complaint. We'll also enter some vitals. So we'll just enter a normal set of vitals here, making the patient nice and healthy. Also 36.5. Now there is decision support in here, and there's also data validation. So if you try to record a vital that is wildly outside the range, as in not possible, it will stop you and give you a warning. And it will also give you some decision support, which we'll see in a second, if the vitals are outside a normal clinical range. So we're going to submit that, and you can see that Cool Test now is at the bottom of the waiting list. So they've been assessed as the lowest triage category, and they have the shortest wait time. The wait list in Tamanu is completely automated. So once you've selected your triage, it knows how long the wait time is, and the top of that will be the person with the highest triage level and the longest wait time. Now, I've been playing around with this earlier. Hopefully no one's waiting for 3 hours and 28 minutes at triage level 1, but that's how it works. It's all automated. You also have a dashboard here at the top, which shows you that your average wait time for level 1 at the moment is 3 hours 30. For level 2, it's 1 hour and 17, and for level 3, it's at 9 minutes. Again, just because we've been playing around. Hopefully, the opposite of that would be true in a normal clinical setting. So to come into Cool Test, we can now click into the patient and we can see their encounter. Now we have set the decision support to be a bit nonsensical for this demo and in this environment. Just one, to demonstrate that it's configurable, but also to give us a few flashing reds. So even though their respiratory rate, their systolic blood pressure and their heart rate are all normal, we've set the normal clinical ranges so that they're unusual. And so this is giving us a bit of decision support to show that they're outside the range. Now, obviously, when we configure it in a normal setting, we configure that so that it's normal clinical parameters. Now, what can we see here? This is the patient summary. We can see their reason for encounter. So they presented at emergency department with back pain. Their triage score was 3, their location, and all of this is available to any clinician in the hospital who has permission to see this record. And in support of, as I say, the interagency integrated triage tool, you've now got several options for what to do with this patient. So you can move them to active ED care. And in that case, for example, you could fast track them. You could move them to emergency short stay if you're going to keep them in and treat them, or you could admit them straight to hospital. Now we're going to move them to active ED care, okay, and treat the patient. So within here, you can enter notes, and you can see that everything we've been doing so far is being automatically captured. So you're not sort of mindlessly constantly entering data. This data will follow them through their whole admission, even if they end up in hospital for 2 weeks. We can see the triage score they were assigned. We can see that they were changed from triage to observation. And then, of course, we can add clinical notes like their treatment plan, which we can add there. And you can also do discharge planning from here. And that goes here. Now, you've also got the option for templates. There's none in this demo environment, but in a lot of settings, we can set up templates so that the note is automatically written, and then you just augment that note by adding your own things. So all of those build up here. The treatment plan is pinned to the top, so every clinician can see it very easily. You can also enter procedures, lab requests, imaging requests, data capture forms, which are really, really flexible. They're really, really configurable. You can capture basically any data against the patient. You can order medications, or you can attach documents. Now, this isn't a demonstration of all of Tamanu's features. There's some other stuff that you can see in our YouTube channel on that, so I'll skip all of those. This patient now, we can assume, has been treated, and we're going to discharge them straight from here. So we discharge them, whoever the discharging clinician was. What was their discharge disposition? We're just going to say normal, and you can see that that discharge planning note that we wrote before has already appeared here, so we can also add to that if we need. Finalize, and that patient is out of here. We've dealt with them. The encounter has been completely captured. It's all there, but when we look at our wait list now, they're gone from it, which is really cool. Now, if we come and we look at someone else who's been in here a little bit longer. Now, there's no set of vitals for this person, but they were triaged at number 1, and they presented at the emergency department with chest pain. Now, obviously, as I said, we would hope they haven't been waiting 3 hours, but we are going to move them to active ED care immediately, and then we're going to start to treat them. Now, once we do that, I want to show you that they've actually come off the wait list now, okay? So there are 0 people here that are triaged as level 1. But you can see now that they are still in the emergency department, so that anyone dealing with them can see that they were seen at 6:16, and of course they can still continue to manage them. So we'll come back into here. Again, we can record vitals, which we've already seen, so we'll just skip that step. And we can see their triage score and everything else. But with this patient, we might want to then move them to emergency short stay, which is the next logical step in that patient journey. You could admit them straight to hospital, but it's unlikely that there's a bed waiting. So we're going to move them to emergency short stay. Okay, and we're also going to move them physically. So we're going to change their location, and we're going to say that they're in, now acute area 1 is already taken. So we're going to move them to acute area 2 and confirm. And away you go. Now, I didn't show you before that I set this up so that you can see that there's fast track area. Of course, how you set this up is completely up to you. So this has got resuscitation areas, this has got acute areas, this has got fast track. And actually, this patient now has been moved to resuscitation area 2, so we can do that as well. Confirm it, and that's where they are now. We also have a setting where you can plan that move and then confirm it later if you don't want to remove them immediately. Again, this environment's not set up for that, but you've got lots and lots of options. Now again, we treat this patient, if they die, we have the full record death data flow, which uses the WHO cause of death certificate as its template for data capture. Hopefully that doesn't happen to this patient and they get treated properly, and we can discharge them straight from there, okay, like we saw before. Or you can do the final step, which is admitting them to hospital if a bed opens up. And in that case, you would probably change the department that's managing them. So change them from the emergency department into the medical or internal medicine, or whoever's going to manage them, cardiology, whoever you've got. You may also want to change their clinician, so assign them to someone else. And of course, you can change their location, their physical location, once they move. So yeah, not even sure. Let's just move them to the general ward and confirm that. And once again, because that patient's now in the hospital, they're now an admitted patient. Their triage score isn't relevant, so that's been removed from the patient summary up the top. But you can still see it if you go into the notes. So if you want to go back and say what was the triage of this patient when they were admitted, you can see it there. And they've been removed from this list because they're no longer being managed by the emergency department. To see them, you would now go into the inpatient listing, and you can see them in there. So as I say, it allows really great patient movement, and allows your patient workflows to work more efficiently, and it automates a whole ton of things. One of the other things that it automates is your reporting. So when you get to the end of the month, you want to run your report. Now, again, reports are really configurable, but you might want to run on wait times in emergency. You set your date range, you click generate, and it will spit that out as an Excel spreadsheet. You don't need to capture it at the end of the day. You don't need to be tracking this manually. There's no more writing on pieces of paper. Every single thing that you do is just being automatically captured in the background, and then you can report on it. You can report on a whole ton of things, whatever you want: deceased patients, encounter summaries, diagnoses, all those sorts of things, all in the one place. So it just reduces your reporting burden enormously. And we can also put all of those into dashboards for you, so that hospital executive can see them in real time in our other tool, which is called Triage. So that's a demonstration of the emergency department module in Tamanu. As I say, we really want to emphasize that it's a flexible tool, and it can be used for a whole ton of things, and it's all centered around the triage tool, which you see here, after which there's just a lot of automation to everything. So hopefully this has been useful. Of course, please get in contact with us if you've got any questions, and hopefully we'll see you out in the Pacific sometime.